not feeling very well, so Eileen took my spot, but I had committed to take the proxy for Anne LeConte, and I was not able to reach her, so I felt an obligation to try to speak on her behalf since she wanted to have a voice here today. So,
Thank you very much.
hello, my name is Susan Kreitzer, and Anne LeConte has generously donated her time to ME CFS Forums to present a statement from the forum to the IOM committee to define ME CFS. ME CFS Forums is an internet forum for people who suffer with myalgic encephalomyelitis, which is sometimes called, as you know, chronic fatigue syndrome. And this forum is also for their friends of ME sufferers. This forum began in June of 2010 and now has over 6,850 members. The ME CFS Forums was not invited to present information to the IOM at this meeting. Perhaps the ME CFS Forums was not invited to present because a forum administrator, Patricia Carter, created a petition to stop the HHS IOM contract and accept the definition of ME on October 7th, 2013. This petition now has more than, and I need to qualify this because when this was given to me on January 22nd, it had 3,700 signatures. As I've sat here today, I have scribbled out multiple times. As I walked up, we were at 5,002 signatures. The petition to stop the HHS IOM contract and accept the CCC definition of ME is solid evidence of the position of thousands of ME CFS stakeholders, the contract that the Institute of Medicine has entered into, and there are thousands of people around the world who object to this contract. This statement from the MECF forums represents the views of thousands of patients, families, caregivers, and friends in opposition to the contract. Millions of people worldwide suffer from myalgic encephalomyelitis. For decades, sufferers have been left with no real biomedical research and no effective treatments. Now the HHS is attempting to prolong this by contracting with the IOM to redefine this illness. This is unnecessary because experts in the illness, researchers and clinicians alike, have reached a consensus, the Canadian consensus criteria. We believe that should be used for both research and clinical purposes. And this has been sent to the Secretary of the Health and Human Services, Kathleen Sebelius. We believe this HHS contract with the IOM is simply a waste of precious resources. And in front of you is the petition that was signed at the time that it was blown up, and we took it to Washington to show to the to the HHS along with the actual petition. This was in December, and this is just 3,500 signatures. And we plan by the end of the week to take whatever signatures we have, and we will give that to the HHS, and we would be happy to provide that to the committee and continue to provide it to the committee if the numbers increase. Thank you.
Thank you very much. And thank you for making the effort to be here today. We really appreciate it. Our next speaker is Denise Lopez Majano.